One of the powers of this particular study was having enough patients so we could have statistical significance if there was going to be any difference between the AYA population and the younger group. What we did find is that AYA patients had higher rates of relapse overall compared to the younger patients, and when we looked at what type of relapse they had, it was predominantly bone marrow relapses and was not CNS relapse. And a very important part of the trial was the finding of a very high rate of what's called remission death. So that is a patient who's in remission. They've gone through the first phase of treatment called induction. They're in remission, they're continuing therapy, and they experience death that's not related to leukemia. These are predominantly infections. And what we found is the AYA patients had a significantly higher rate of remission deaths compared to the younger patients. So the combination of having higher relapses and also having higher remission deaths leads us to, when we look for strategies for the future, to look at both trying to come up with more effective therapies for ALL to reduce the remissions, but also to think of some creative ways to decrease the toxicity of therapy, to decrease the remission deaths that we saw on this trial.